Mm-hmm.
Sorry.
Hey.
Mm, mm.
Well, something on my screen is telling me that I should send a request to you to be joined, to be part of the live. And if I press cancel, if it get rid of me, you got to add me back.
Wow.
Okay. I'm
We
still here.
about to have these technical issues.
Well, I don't know. It just was out of the blue. It was like send a message to request to be part of it. Maybe that's just the message that everybody see. I don't know.
You here for you got on right away, so I'm happy about that.
See, I did good.
You did good today.
All right, we'll let people trickle in.
Come in.
How was your day?
It's going. Here working on call. It's been a crazy week. Well, yesterday was it's tough. It was tough cases yesterday, so I have to stop like scheduling like huge cases like that like on the same day. It's very draining.
So you have multiple big cases on the same day?
Yeah,
And like they fibroids was really big?
Yeah. So
Oh,
it's
wow.
like, yeah, like myomectomies, like hysterectomies are are less taxing. I mean, if you're doing robotic surgery, but these myomectomies like are getting crazy, and then it's like because it's not even really getting the big ones. Honestly, the big ones are not the problem. It's all getting all of the little ones. It's like
Because you got to feel
you
for
got to
it
feel
until you're
for it. And you're just
satisfied.
sitting there just feeling and feeling. That's the problem. If it was just a big part and I'm done, I'll be good. But it's just the insistence on getting all of them is the part that takes a lot of time, and it's very, very draining. I mean, it's like I was operating probably like 10 hours yesterday.
And you
So
take
it's
a
about
break in between?
what's that?
Not a lunch break? No dinner
No,
break?
I mean I eat real quick. I mean between the cases I eat real quick, but then once they finish cleaning the room, it's like you
Next.
back, that's next. Keep rolling. So whatever. Anyway, let's get to it.
All right. Well, welcome everybody. Welcome, welcome, welcome. This is our monthly live. If you joining for the first time, I am one of Dr. Johnson's patients. So we do a monthly Q&A. I shared my journey across social media of me treating my own fibroid disease that I suffer with for many, many, many years. And I'm usually here to answer the patient side of questions because I definitely can relate to being a patient. And obviously we have Dr. Johnson here for all the medical information, so you can be more informed in your own visits, or you can find out information so you can actually visit Dr. Johnson and resolve your health issue as well. So if you have a question tonight, please feel free to drop your question in the bubble at the bottom that has a question mark. So that way we can keep track of it, and that way I can screenshot at the end to make sure anything we didn't get to, we can answer. You can also send a request to join the live. And if you join on the spot, you can ask any question you want. And it's almost like getting a free consultation on the spot. And he can get specific about your case, because some things is just too general. And then last but not least, I do have people that submitted since the last live that weren't able to make it or usually have to watch later. So they do send questions as well. All right. So are you reading something?
No, I'm putting this just information like where to find me
Yeah.
and all that stuff, so I can pin that up right now.
I was
That's
definitely, yes. I didn't know if you was reading
all.
something, but please pin your information so people know how to reach you.
Yeah, I'm doing it right now. Yeah, I'm doing it right now. Okay.
All right. All right. So, Mom, you want to go first?
I can.
Okay. All right. So my mom is where I get my social media skills from. So since she didn't know how
Oh,
to join
Ma,
the
that's not a good look, Mama. Don't let her.
live, since she didn't know how to join the live, she's gonna ask her question in person. But I also, besides her question, I do want her to share with the viewers not only when you're suffering, the impact that it has on the people around you. So I suffered with fibroids for a very, 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 very long time. It's almost embarrassing how long I suffered. So I wanted her to talk about that, but she does have her own question. So question first or you story time first?
I'll do my story.
Okay.
You.
All right. I'm going to let her tell her story.
Hello, everybody. Dr. Johnson, glad to meet you on the screen. Hopefully, I'll meet you in person one day.
You will.
I just wanted to say that when my daughter was suffering with her fibroid issues, as close as we are, I had no idea the extent of what she was suffering with. She's very good at hiding it. And I would like to think if I had known the extent of it, I would have gotten her to seek treatment for it a lot sooner. But knowing her, she's very strong-willed, and I don't know how much I would have been able to sway her. But the point is, once she got the treatment, her life is turned around. Her quality of life is so improved. She is such a different person. I would have to say, without knowing what was going on with her, I could tell that she wasn't a 100% herself. And now she is 300% herself.
Too much myself.
And I'm probably her biggest fan, that she got it taken care of and is living her best life. So I'm glad she did the research she needed to do to find Dr. Johnson. And he obviously was the surgeon that she needed to get her to the place that she would be comfortable to take care of it. So it has just made all the difference in the world. And I'm eternally thankful for it. I still get emotional about it.
Yeah, I was suffering bad.
Yeah.
I was suffering bad, y'all. I'm telling you.
It was bad. It was bad when she finally let me in on a lot of the effects she was having that I just had no idea. And I don't know if it was just strength that I don't know how she did all those years with everything that she informed me were the effects from it. It was horrible.
I conditioned myself.
So it's good that that's all behind us. And now she's living life like it's golden.
I'm 2 years down.
Oh,
I
wow.
haven't seen them long. That's crazy.
But my question is not female per se.
When you join, you get to ask what you want.
It's a question I've been wondering about because I've heard different opinions from people and other doctors and YouTube videos, and it's about statins and cholesterol. And
Okay.
and my question is the only way to deal with cholesterol issues statins, or could it be handled with dietary changes and exercise? Is that realistic to think it could be handled that way?
That's an excellent question, actually. And so the answer to your question is yes and no. There's really no true clear-cut answer. So what she's referring to, everybody, is hyperlipidemia, which is the technical term. The true term is, that we know, is just high cholesterol. And she's asking about medications to treat high cholesterol level. There are people that will argue with me about a lot of different things that really don't understand how medicine works and what things are, right? So for many of the ailments, it's true. And somebody hopped into my DMs about, like, that's a herbalist and wanted to argue with me on a show I was on. I was on Heather B in the morning, and I was literally talking about fibroids, and she wanted to debate me about medications and herbs to treat, other things. And I'm wholeheartedly a proponent of eating and living your life healthy, right? I do it. I post it. I had multiple things all through COVID where I'm working out outside, encouraging people to eat healthy. And every patient that comes into me, I am encouraging them to, eat healthy and live healthy lifestyle, which includes exercise, uh, rigorous exercise, and healthy diet. With that being said, your diet does control a lot. It can help cure a lot of ailments, some hypertension, some high cholesterol, some diabetes. It can make those things better. But it's also true that we have common diseases that we have that are not going to be cured with diet and exercise. For instance, hyperlipidemia or high cholesterol, it does have a genetic component to it, right? So just as people that have a high cholesterol diet and have hyperlipidemia or high cholesterol because they, eat certain foods, there are also very healthy people with high cholesterol levels that eat healthy. For instance, like for myself, like I went to the doctor, all transparency, a few months ago, and I had high cholesterol levels. For me, the reason why is because like I had a lot of seafood in my diet. I'm a seafood lover. I was eating a lot of shrimp, eating a lot of things that were high in cholesterol. So for me, I was able to correct my cholesterol levels just by diet modifications. However, there is a true disease called hyperlipidemia, which people are genetically disposed to having high cholesterol levels. And it doesn't matter how their diet is, they're going to retain cholesterol and have these high cholesterol levels. Same way with hypertension. There is a thing, yes, shrimp is very high in cholesterol. Seafood is very high in cholesterol, whoever's asking the question. But there's also, a thing called benign essential hypertension, whereas we always think that if you just correct your diet and you're going to have normal blood pressures. I have people that work out actively, that eat very healthy, that still have high blood pressure, and because they have a disease called benign essential hypertension. So the thought of eating right, vitamins, whole, raw vegetables, foods, or whatever for your overall general health, absolutely. And even for some of the ailments that we have that are self-inflicted, that can be controlled with diet, it's going to improve it. However, don't be very understanding that there are diseases that have minimal to do with diet that have to have medications to control them in order to give us a high quality of life. And so I just want to say that, and there's going to be people that argue, and it's people that, feel that there's a conspiracy with medicine or what have you. And I'm not saying that there wasn't, there has been a major just conspiracy as far as medicine is concerned with Black people, whatever. That's true. All of that stuff is documented. However, in 2023, where you have Black doctors like myself that are not going and for the banana in the tailpipe anymore, and is teaching our people what is the truth about medicine and how to really treat ourselves, and what is and what isn't, understand that I'm not going to sit up here and tell you that, you need to take medications for everything and that's just the way to go. I'm going to tell you that you do need to take medications for certain things, and healthy diet, exercise are going to heal a lot of the ailments, but just not everything. So for someone like yourself or anyone that has high cholesterol or even high blood pressure, the very first thing you talk about is diet modifications, right? So if you have high cholesterol, nobody should just automatically put you on medication. There should be a 3-month trial where you are decreasing the amount of high cholesterol foods, right, to see what those lab levels look like, to see if they're trending down to a level that is normal. And if they are, now you have your answer that you can control it with diet. So diet control hyperlipidemia, diet control hypertension, diet control diabetes. However, if you do a 3-month trial where you are actively working out and you have actively cut your diet to where it should be normal levels of your lipids or your cholesterol, and they're still abnormally elevated, it would be foolish to continue doing that exact same thing. It makes all of the sense in the world to get those levels down, because if you go around with very high levels of cholesterol, you start to build plaques into your vessels, and now you've increased your risk of coronary artery disease, stroke, blood clots, those things. All of those things are now increased because you're walking around with high levels of cholesterol. You're walking around with high levels of blood pressure that you're not controlling. So all that to say, I hope that answers your question, but that was just more so a great question just to have the conversation of diet and exercise. Because if I hear one more person come to me and say, all you do is try to operate on women, all you do is, try to get rich off opera. I did not just sit up here for 5 hours taking out every bit of somebody's fibroid because I'm getting rich. Trust me, I could have stopped and not done that and done many different things that would have made me more money than what I did yesterday. But I did it because it needed to be done. So when you have people that are vested in your health and that are telling you the truth, please believe them. So that's it.
Hey, thank you.
All right.
That's good. Appreciate that.
No problem. And pleasure to meet you.
You too, doctor.
Mama Cola.
Right. I was like, you just don't have to sit here to join.
Yeah, all of this is all you.
Yeah.
Like that's, you can say, all of this right here.
I wish myself to look like my mom, because when I was a little girl, okay, story time right quick, y'all. When I was a little girl, I looked almost identical to my dad. I still have some of his features, and I was way more brown skinned, which wasn't an issue. But people used to at school say I had to be adopted and she wasn't my mother. And I didn't tell her that, but I used to be so sad. Like, well, what if somebody finds out, and what if she not my mom, and what if they come take me away from her? Like, I like her, I don't want to leave. Like, I was so paranoid. So I used to be crying and just dealing with that. But I dealt with a lot of stuff by myself, y'all. But anyway, long story short, when I turned 11 years old, I started changing, I guess, puberty, everything. And I started looking more and more like my mom.
Extra light skin.
Yeah, my skin tone changed and everything. Although I'm tan right now from Turks and Caicos, but yeah, I changed. So I just, like they say, you never know what your kid's gonna end up looking like. I look like her definitely now.
That's the same way. My daughter looked just like me when she was younger. I think she starting to look more like her mom. And she's on here. She's gonna be like, no, I don't. But she was starting to look more like her mom the older she gets. My son's starting to look more like me the older he gets. It's kind of flip-flop.
Yeah, they flip-flop on you. So I still see certain things.
Yeah.
And I'm still my dad's junior, but at the end of the day, I willed myself, because like I said, I used to be so scared that the people was gonna come take me away, because they was like, she's not your mom. Nobody believed she was my mom. All right. So question. And if you just join in, please put your questions in the bubble with the question mark, so I can go back and forth and I can mark off the ones we answered. And you're still welcome to send a request to Dr. Johnson if you have your own question that you want to pop in the live. And you can also ask me questions as far as the patient side. All right. Is there any way to prevent or slow the process of fibroids growing back? Would you recommend someone getting a second myomectomy? So,
and that's a great question. And so this is what I try to tell people all the time. So, as long as you have a uterus, you have a potential to have problems. You have a potential to have bleeding. You have potential for fibroids. You have potential for everything. The reason we keep our uterus is for a purpose, right? If you want to have a child, which is the only purpose you have a uterus, you don't take it out. You keep it and you go through any possible risk that you could possibly have in order for that purpose. With that being said, as far as myomectomies are concerned, this is my stance. And I really can only speak on experience. Like everything that I usually talk about has data behind it. But the data shows that for myomectomy, myomectomies, you still have about a 30 or 40% risk of it returning even after myomectomy. I disagree with that data. The reason why I disagree with that data is because when they do these studies, they do studies of every surgeon. Like, we're not built the same, we're just not. Right. So I teach all over the country, and I listen, and I watch, and I see people go through surgeries in which surgeons left fibroids that they didn't feel comfortable taking, that they thought were not going to be significant, that, you know, are really small, that they didn't matter or what have you. And they do these surgeries and they leave fibroids behind. And so when you look at studies, you're looking at people that are extremely thorough like myself, and people that actually leave fibroids, or you know, looking at a wide gamut of surgeries and looking at those success rates. So those success rates are skewed. So for me personally, what I will say is that when you take the time to get every single fibroid out, the chances of the fibroids recurring are extremely low. I can't recall a patient that I've done fibroid surgery that has come to me for recurrence of having to have fibroid surgery. And that's because 5 years ago, and this is another issue that I have, and what I try to tell people. So for everybody that comes to me is like, oh, well, why don't you just do laparoscopic myomectomies? You don't know what you're talking about, blah, blah, blah. I am a laparoscopically trained surgeon, right? A robotic surgeon. Cola got a robotic hysterectomy, not myomectomy. 5 years ago, I stopped performing robotic myomectomies, stopped performing laparoscopic myomectomies. Why did I do that? I did that because every fibroid case, I mean, every single one, when I go in to remove fibroids, there's always more than what was reported on the ultrasound, MRIs, always more of them. So for me, the only way, and that's for anybody, not just for me, but the only way to get all of the fibroids is to actually feel every single fibroid, because literally you'll have fibroids that are the size of a pea or marble or a booger, like literally that are inside of the muscle of the uterus. If I can only see, I said booger. I did say that for everybody's listening. I said booger. So for that, you will never be able to see that. So from a robotic standpoint, I'm in there, I'm looking, I'm digging, I get, or what have you. If I have something the size of a marble or a pea that I leave into the uterus, that has the potential to grow into something the size of a football. The only way to truly give a patient the highest chance that that will never happen again is to get it. So that's the number one reason that I stopped doing robotic myomectomies. The number two reason is that you have a C-section following it anyway. So if you're going to have a C-section and you have to get all of the fibroids, making small, low incisions in the pelvis is the way to go. So you can get all the fibroids, right? And that's the key, is getting all of the fibroids when you have fibroid surgery. Now, an answer, should you get repeat myomectomies or repeat surgery? The answer to that is what is your goal? If your goal is to have children in the future, and you have fibroids that are causing infertility, that are blocking the cavity of your uterus, then the answer is yes. You have to do what you have to do in order to make those things happen. But if you have recurrent fibroids and they're not giving you issues, and they're not causing you infertility or not causing problems, then no, you don't have to get repeat myomectomy or repeat surgery. But it really kind of just depends on what you want and what your goals are. As far as the treatment of fibroids, prevention of fibroids, they are doing some very, very good studies and significant studies at the University of Chicago right now. And what they found was preliminarily is that there are genes that code for fibroids, right? These genes that people have is 3 different genes, but one of the genes that women have will predispose them for the growth of fibroids. So what they're working on is a detection rate, a detection method rather, similar to a pap smear,
that will detect this gene for women that are high risk for fibroids. So if you could get like a pap smear and say, hey, you're going to be at risk for fibroids, they're now working on primary prevention of those of fibroids, which they've found vitamin D and a couple of other different vitamins that they have that are working on the prevention of them. Now, when you have fibroids, it's not much that you could do. They looked at the studies and said when they're already there, it's not a ton that you're going to be able to do. People think, or argue about me with this, CMOS, fibroid blaster pills, doing all this other stuff y'all talking about. There's no studies on it. So if there's no studies on it, you can waste your money all day long, but realize like you really need to invest your time and money into things that work, because everybody's on the time clock, right? So if you have problematic fibroids, wasting years trying to do diets and teas and things that are not proven is not really beneficial for you. Understand your options. But as far as them coming back again, choosing a surgeon is going to be dedicated to removing all of your fibroids is the best method for successful myomectomies without return of your fibroids. All right, I'm done. I'm talking about that enough. I got to get off myself. Y'all asking these soapbox questions.
Yeah, no, it's good to be thorough because people will misinterpret.
And they ask it, don't worry, somebody not going to listen to this like, well, what do you think about laparoscopic myomectomy? I swear to God, it'll be tomorrow. Somebody's going to ask me about robotic myomectomies. And
they definitely going to do that. Yeah. Trust me, it happens. Mm-hmm. All right. Next question. I haven't had a cycle since February, but my periods have been irregular for a while now. Am I in menopause?
She said she hasn't. How old is she? Did she say how old she was?
Can you drop in the chat how old you are, please?
So, let me see. Almost 5 months post-op. Can the patient conceive after my memory? She said. I didn't even see. All right, so I'll at least give the general definition. So menopause is to have a complete cessation of your cycles for 12 months and of menopausal age, and no medications or pregnancy or anything else causing you to have amenorrhea or no periods. So if you are upper 40s, low 50s, and you do not have a period for greater than 12 months or greater and are not on any medications, don't have any other medical issues, aren't any or pregnant or anything like that, and you stop your cycle for 12 months, you are in menopause. That is the definition. And if you start bleeding after that, that is a problem that needs to get worked up to make sure it's not a cancer or some other type of issue.
Oh, she's 42.
Probably not. So you got to give it 12 complete months. If you really, really want to know, there are some lab tests that you can to test to see if you are. Is there such thing as premature menopause? Absolutely. So there are women that can go into menopause in their late 30s, early 40s. That does happen. But that's, much more rare. It happens. I've seen it happen multiple times, but it doesn't happen too often.
Okay. If you have
somebody trying to hop on here, hold up.
You gotta request to join.
Should I let somebody jump? So it's a couple people want to hop on. I'll let somebody hop on.
Right, yeah, go ahead.
Hello. I don't think thought she was gonna hop on. Hello? Or maybe not. Going once. Going twice.
Hi, ceiling fan.
Yeah, hi, ceiling fan. How you doing? You got fibroids? No. Let me see. All right. I'll kick her out and put somebody else in. Move her. She ain't really want to talk. Let me see who else is on here.
You brought snack. You know I have to have a snack with me at all times.
She's like, man, he talking too much. I gotta eat something. I need to eat something too.
Hello.
Hello.
I'm the one who had the questions about the menopause.
Gotcha.
So hello, Dr. King. Hello, Cola. How you doing?
Good.
So, and I had actually had typed some up too. So yes, the menopause part I am concerned about because of my age, and I think I had perimenopause before, and I did come over here once before, but I haven't, like I was saying, I haven't had a period since February. And then I also wanted to know if I took like birth control early on when I was younger, did it affect my irregular periods right now?
No,
Oh, okay.
that's
And then
that's
so
been the
like
case. Go ahead.
okay, I'm sorry. And then like IVF, is that for people who have like menopausal problems who don't have any more periods?
No, so in IVF or in vitro fertilization, so when I talk, I'm talking to you and I'm talking to everybody. So just kind of bear with me. So IVF or in vitro fertilization is fertility seeking, right? This is strictly for fertility. And what they're doing is they're looking at particular problems that would cause you to have infertility and trying to mitigate those problems to get you pregnant. So they have to look at male factor, they have to look at female factor, factors
Okay.
that impact you, and see where the problem lies at. So typically women in their late 30s, early 40s, mid 40s, at some point in time, your ovarian hormones are going to start to decrease
Okay.
drastically, and your egg quality is going to start to diminish. It happens to every woman. Women freak out about it, but it is the cycle of life. It happens. With that being said, you just have to really figure out where you're at in that part. And a IVF doctor, or a fertility doctor rather, is someone that's going to find out where you're at in that process and see if or what can be done to get you to pregnancy, given whatever state you're at. If you have too much of a diminished egg quality, then sometimes it's not possible for you to, at a certain point, it's not possible. Like people were like, well, it has to be. No, at a certain point, it stops being possible. Just like a woman in menopause, right? You can't, it's very difficult to get a woman that's in menopause pregnant. She just doesn't have the egg quality
Right.
to do so. So that's where they will be at with you, just seeing where you're at. And I will say this, it is extremely important for women that are, in your late 30s, early 40s. If you are seriously thinking about getting pregnant, you have to be proactive with it, right? Because your egg quality is going to decrease, and the longer you wait, it's decreasing by the day. So if you don't have an active plan, the best thing that you could do for yourself is to bank your eggs or freeze your eggs, right? Until
Okay.
you figure it out. Freezing your eggs is just like a timestamp. So if you're 42, you want to try to freeze 42-year-old eggs as opposed to waiting until you're 43, 44 and wait to that point. Even earlier than that. So women that are in
Right.
their mid 30s or whatever, the earlier you could do it, the better your chances are of being able to do something with those eggs, moving forward.
Okay.
But that's what I said. So if you really want to know where you're at, you need to just talk to your doctor, and there are labs that can be done that will figure out exactly where you're at in a spectrum of menopause. But probably not. You may be in what's called perimenopause or very early menopause, but you shouldn't be there yet. Just because you haven't had a period in 4 months, which is since
Okay.
February, does not
Well,
mean you're in menopause.
they've been irregular
Yeah,
before though. It's been irregular for a while, so
yeah,
but that doesn't mean
and that could be
okay.
that. It's a lot of things that could deal with that can cause that. It's a lot of weight. It's a lot of different things that can cause your period. Stress,
Yeah.
uh, different diets. Like it's a lot of things that can cause your periods to be off. But
Okay.
if you really want a true answer, there's some labs that can be done to figure that out.
Okay. And then I just have a couple more questions. So like I'm just looking at the paper. So what is your take on like birth control pills for like irregular periods, and like if you're like in your early like 18, 19 and you're like my daughter, she has irregular periods. So I'm thinking, did she take out the meds? Like hers is coming on early. Mine was like clockwork when I was
hmm
younger. And so but hers is like taking a different turn for me.
So I'm not against birth control pills to regulate menstrual cycles. Like typically when you're very young,
Mhm.
a couple of different things are happening. One is that your body just has not hit a normal ovulatory cycle. So if you're not ovulating normally, you can have irregular periods.
and birth control pills are the bridge to get you to where you're ovulating normally and you can have a normal cycles.
Okay.
In addition to that, weight is a huge thing. For younger women, there's less body fat typically,
Yeah.
right? And when you have that, you can have very irregular cycles that happen. Or if you got too much
Yeah,
body
she's
fat, that can cause very irregular cycles too, which somewhat normalizes when you get older. And I'm speaking in generalities because every situation is different, but generally speaking,
okay.
it is one of those two issues. The younger you are, and utilizing a hormone suppressant until you get to a point where we're going to have regular cycles is okay, right? Even my own child has issues with her cycles or what have you, and I'm like really close to putting her on a suppressant if it doesn't straighten
Right.
up, right? So I wouldn't preach to anybody or tell anybody to do something that I wouldn't do for my own family or my own
Okay.
kids. So putting a younger kid on a suppressant and having a conversation to say this isn't just carte blanche for you to just have sex and do whatever you want to do. This is for this
Right.
particular reason. It's absolutely okay to do.
Okay. And then, okay, this is my last one. I just thought about it. So, so for older women, or like I'm 42, so like birth control pills at my age, is that risky?
Yes. Well, I wouldn't say
Okay.
so. Birth control pills in of themselves, any estrogen containing hormone. So that means birth control pills, the patch, NuvaRing, anything with estrogen in it has a risk associated with it,
Okay.
right? They do. They have a risk. There's a risk of clotting, or it's a
Yeah, that's
small
what I
risk.
heard.
It is a low risk, but there's a risk. That risk slightly elevates the older you get, right? And people will say, people like, I'll just take birth control pills. I'll just take that. Well, my patients that are over 35, can you take it? Yes. But my thing is, it's like I don't just freely give out birth control pills to my patients. But I'm asking, what are we doing here, right? What do we want to do? Are we getting pregnant or what have you? If we are not trying to get pregnant, there are multitudes of different progestin only contraception methods that don't have the estrogen, that are safer for you, that can stop you from getting pregnant. I'm not saying you don't have to get on any contraception or birth control, but birth control pills is not it. That's more temporary to say, hey, I may want to get pregnant 3-6 months or whatever. But if you're 42 and you like, I don't have no intentions of getting pregnant, I'm not going to keep you on birth control pills till you're 50. I'm not going to do that to my mama or my sister or anybody. So I wouldn't do that to my patients. So I would not recommend that. If you really are serious about either getting pregnant, yes, temporarily, I will put you on birth control pills before I put you on an IUD or Depo or anything like that, because we want to get off of it, get you pregnant quick or what have you, and then talk about long term after that. But for the immediate, for the immediate, yes, but for long term, no, would not do that.
Okay.
Okay.
I thank you for your time,
You're
Dr. P.
welcome.
Thank you, Tola. Sorry,
Of
I had a
course.
question.
You're
So
welcome.
thank you.
All right.
Okay. All right.
Hey, talk for a minute, Cole. I got to answer this real quick.
All right. Well, that's perfect timing because the next question is for me anyway. All right. So the next question is actually directed to me. What was your recovery time back to moving around yourself and back to work? All right. So first off, just to clarify, if you just joined in or you don't already know me, I had the robotic hysterectomy. So that means I didn't get cut open. They made little incisions in my belly to remove my uterus and my cervix. I did not get any ovaries removed because my ovaries were perfectly healthy and I am not in menopause or wasn't going through. My levels were fine. So I kept all of that. So my normal feeling like myself was definitely within the first 1 to 2 weeks. You do have tenderness where the incisions were. Well, I had tenderness where the incisions were, but feeling like myself, being able to walk around the house, being able to go up and down stairs, you know, just the things that you do day to day, I was fine within the first 1 to 2 weeks. I didn't go back to work until a month, but that was not because I had restrictions on returning to work. It was Dr. Johnson basically told me I could go back based on how I feel. I had a lot of blood loss during my surgery. If you watch previous videos, my size was exceeding normal. So I needed, first of all, I needed a little bit more. I needed a little bit more recovery time than most people. I was very exhausted. You know, like my energy level needed to come back. But like, just like I said, feeling normal, feeling like yourself, you feel that within the first 1 to 2 weeks. And then leading into actually a submitted question, because I had a couple people reach out to me about the Real Housewives of Atlanta episode, which I didn't get a chance to watch. So sorry, y'all. I was going to try to watch it before the live. They said that the sex is 6 weeks. That is, in my case, it was actually 8 weeks. But yes, it is true that after a hysterectomy, you are supposed to wait 6 weeks before having sex. And they wanted to know, was it the same for myomectomy as well? That was a submitted question.
Cola was like, do you think I need to get this removed, or can I just
That's my baby, leave her alone.
Right.
She know I'm messing with her.
That's my baby, leave
I
her
know.
alone.
I know she came through with a whole little person growing on her, talking about I don't feel like doing this.
Yeah, I was still saying, like, you sure?
You sure
Nothing
we
can do.
can't do something else? Yeah, all right, no, we ain't gonna be able to do that.
And Dr. Johnson told me that I had 6 to 8 weeks to think and get my mind right for surgery until they saw the ultrasound. And then they was like, you got to go as soon as I got to open it. I was so hurt. I thought I had a lot of time to get my mind right.
In that order.
Be like the slingshot. They be talking to you, and then they put you in.
Just start rolling you back while you talk.
Yeah, that was what he did. He was like, oh, no, you next available. I was like, wait, what? I thought I had time to get ready. So, recovery was, like I said, the question was for me, so I just answered my question. So, yeah, feeling like yourself, you'll feel good 1 week, 2 weeks. I know people the other patients that have reached out to me to discuss their journey that have actually went back to work the same week. Like, it's no restrictions based on how you feel. My case was a little different, so I did take a little bit extra time, but it wasn't because I didn't have complications or post-op complications or anything like that.
Mm-hmm.
So
somebody wanted to hop up on me.
The question was leading into, is it the same 6 week period for sex for myomectomy though?
No, it's not.
Okay.
So the reason why you have to wait for a hysterectomy is because when you get a hysterectomy, it literally is cutting your cervix. So your oh my little thing go.
And if you go see Dr. Johnson in person, he definitely gonna draw some pictures for you. So you're gonna have a thorough understanding.
I gotta do my little thing so it's to give you a visual.
Pick him for y'all partners in Pictionary.
Yeah, so I don't know where I ain't gonna waste time looking for it, but it is literally cutting. Oh, here it goes. So, all right, there it is. So, when you have a hysterectomy, you are literally cutting, like it's a cup. It's like a donut, if you will, that we put through your vagina and goes up and hugs your cervix like this. And then when you go laparoscopically, you go cut off, get all the blood vessels, get all that stuff out. And then that cup is down at the bottom. You go from the top and literally cookie cutter around that cup that's in your vagina. And when you do that, it's a hole there. And that hole makes all of this stuff come through it. Like you could now remove the uterus, fallopian tube, cervix, everything that you disconnected up here goes through the vagina. When that happens, now you got a hole at the top of the vagina that's like this. You have to suture up that hole and sew that hole up. The reason you have to wait for sex is because You don't want a penis poking at that newly closed up hole, because that hole separates your inside world from your outside world, because you still got bowel and bladder and everything in your belly that you want to stay in your belly and not go through your vagina. So that hole has to heal, and you need to give the whole chance to heal, which is 6 weeks at least, for it to heal, so that now your inside world don't meet your outside world. That's as graphic as I can get it for you. But that's the reason why you don't have sex after hysterectomies. Myomectomies are different because you're removing just the fibroids. You're going in and you're just getting the fibroids off and keeping the uterus intact. So I mean the cervix stays intact. So it doesn't really matter. The penis is hitting cervix and vagina and the normal stuff that it hits. It's not having this gone with a hole in the vagina, which is why after a myomectomy you can have sex as opposed to a hysterectomy in which you can't.
So what's the weeks for a myomectomy?
For sex, I mean, like, you just had surgery. So I mean, I just generally say like at minimum 2 weeks. I mean, you're really not gonna feel like having sex because you had a major surgery. But it's really no particular, like, oh, you gotta wait this, because it's really no marker. It's like whenever you feel like you up to it and you're not doing that crazy. Because if you put too much strain or do too much, then you go be in pain just because, you know, you just had surgery. But as long as you can kind of relax and not overexert yourself, then you can have sex whenever you want to after myomectomy.
So my advice as a patient, don't pick the procedure based on the sex recovery time, because I didn't see the episode, but if a person's not willing to wait for you to fully recover, they're not worth it anyway.
I didn't see it. I saw the clips of it. I know the
I didn't see it either, but I got a lot of inboxes about it, so that's why I said I would definitely ask. Yeah. So did you say you had somebody that was trying to join?
Yeah, I'm gonna add it real quick. Should have came in. Unless she's not trying to come in. Oh, there she go. Hello.
Hello.
Hi. Can you guys hear me okay?
Yeah,
yes.
We can hear you.
Awesome. So I asked a question in the little question chat, and so I'm almost 5 months post-op from a myomectomy, and I just want to know, just from a doctor's standpoint, because I'm getting like conflicting information,
Sure.
What would be an ideal time to conceive?
6 months.
And okay, all right. So I'm
minimum.
Yeah.
Minimum. That's minimum. In a perfect world.
Okay.
In a perfect world,
Mhm.
I personally would prefer you wait a year or more, but the textbook answer is 6 months. I tell my patients after myomectomy, don't even think about it before 6 months. If I have my way, it will be like 18 months, but 6 months is the answer, right? Because you have to realize with a myomectomy, you are going in and you're literally changing the entire architecture of the uterus.
Yeah.
You're moving large masses out of the uterus and then reconstructing the uterus. Like, for instance, like I did a myomectomy on the lady yesterday, in which her, like, she has a differently shaped uterus. It's called a bicornuate uterus, but for her, the fibroid stretched her uterus so far out, and it changed it so much that I pretty much have to do like cosmetic surgery on it, to where it's like,
Oh wow.
I had to trim off a lot of normal tissue because it was so out of shape and misplaced because of the fibroid. And then I had to kind of reconstruct her uterus at that point. So with that being said, you don't want to go put a baby in that and then have that grow 20 times its normal size until it's healed to a point where it can accommodate that. You do that too early, and now you have not only fresh tissue that hasn't healed, but it's not ready to accommodate a pregnancy. So you want to give time for healing. So the quick bones answer your question. Minimum 6 months, but more time, if you have it, would be optimal.
Okay, I'm 39, so
so you don't have a lot of time. So you got to get 6 months. 6 months. 6 months is the answer.
Okay.
All
All
right.
right. Well, I appreciate you taking my question.
No problem.
Thank you for joining.
Oh, thank you for having me.
Absolutely.
All right. You got more on the wait?
No, there's nobody else on the wait. And then you can get back to questions.
Okay. All right. That was her question. Do or will you help someone dealing with perimenopause? Do you treat?
Yes.
Yeah.
Yes and yes. I do.
All right.
I do help people and I deal with it. Yes.
All right. How many times a week do you recommend working out to live a healthy lifestyle in addition to healthy diet changes?
Optimally 4, 3 to 4.
And how many minutes are those?
40 minutes. I would say at least 30 to 40 minutes of aerobic exercise. You need to sweat. You need to be like moving and doing things. Like people say, oh, well, I walk at work. It's great, but you need to, elevate your heart rate, right? You need to like burn calories. Like, so, that is, if you could do that 30 to 40 minutes, 3 to 4 times a week, you're golden. That's awesome.
All right. I'm 42 years old. All of a sudden, I have extremely heavy periods, and sometimes they are very long or very light and sporadic. Any reason that you can think of this offhand?
Multiple. So one is as we've been discussing, perimenopause can be 2 years, 3 years, 5 years, 8 years. Like at a certain age, your ovaries are starting to decline. They're starting to not put out as much hormone. The egg quality is starting to decrease. It's not starting, it's been decreasing, but it's starting to hit a slope, and you're not ovulating regularly. It's your body changing. So this can cause abnormal bleeding or heavier periods or longer periods or periods that don't come every month. This is a physiological change that can be explained very clearly. And it's not anything that you did, not anything you ate or not working out or whatever. It's just a physiologic change that some women go through. Some women don't ever have that problem. Some women just ovulate, and then all of a sudden just don't have a period. And that's it. And they don't have the irregular bleeding or what have you. It doesn't happen like that often. Typically, there's some variation of irregular bleeding. It happens, but it doesn't happen for everyone. So, but when you are in your late 30s, early 40s, mid 40s, and your body starts to do certain things where it's like, hey, I haven't had a period in 2 months, or hey, I had an excessively large period. It's never happened before. Typically, that's the sign that things are changing. So with that being said, it's not much that you can or need to do about it unless it's hindering your quality of life, or you're trying to get pregnant and you have plans of getting pregnant. Then you need to actively go seek some consultation and fertility treatments so that you can execute your plan. It's a sign that your body is changing, in a nutshell.
All right.
Usually. Now, sometimes it might be medication, maybe stress, maybe other things, what have you. But typically, in that age group, that's what's happening.
All right. Next question. Do all fibroids have to be removed?
No, absolutely not. If fibroids are not bothering you, if they're not impacting your quality of life, they're not excessively large, having normal periods, not pain, no pain with sex, no frequency of urination, no true problems, then you do not have to touch your fibroids. You don't have to do anything with them. Many, many, many women live perfect lives without having to have their fibroids addressed. Like people think, I'm just, is everybody, if you get fibroids, you got to get it removed. You're just trying to operate on people. Absolutely not. I'm the first one to tell you that when you have fibroids, if you come to me for fibroid consultation, I'm going to be very honest and tell you, hey, you don't need surgery, or there are other options that you can do that would be better for you. Like, I'm going to be very honest with you. Everybody that comes to me does not need surgery, and I'll tell them, you don't need it. If you do, you do. But no, everybody doesn't need it.
All right. The next question. The next question is for me.
Good.
Cola, was it painful to have sex again? No.
They
It
want
doesn't,
to know about that sex.
man,
They
y'all
worried
some
about
hot
that.
followers.
Right.
No, it was not painful to have sex again. It does. I mean, it's just like I've had children before, so you have to wait to have sex after you have kids, and you may be nervous or be thinking it's going to be painful, but the vagina is a muscle and it works like it's supposed to work. Your vagina does not change from having a hysterectomy. I get a lot of people that are worried it's going to change, it's going to fall out, it's going to dry up, it's going to turn into an alien monster. No, it does none of that. Whatever you started off with is what you will end up with if you have the right doctor. That's all I can say.
Yeah. And everybody just like dropping comments like during in the feed or questions. You can drop comments during the feed, but it's difficult to follow the questions in the feed. So just go and drop them in the question box section so we can answer them. But if you're doing it in the comments, it's like as people make comments, it's very hard to follow questions like that. So if you have a question that needs to be answered, just please put it in the question box comment.
Yes. Sorry, I do see the numbers have changed.
Yeah.
So yes, use the question mark bubble at the bottom, and then you still can send a request to join. How long are we doing today?
We got another half hour.
Okay. I just wanted to make sure because I'm watching. We almost 3 minutes from the hour, but it'll let us do an hour and a half.
Yeah, that's all right.
Okay. All right. So there is a question in the chat about having a myomectomy again. So we answered that at the beginning. So we are going to post this. So watch the replay. If you want to know about should you repeat a myomectomy for a fibroid that is causing symptoms, rewatch the beginning. He will post that. We definitely address that one. So next, is low ovarian reserve a sign of early menopause?
Absolutely. You got low ovarian reserve. That means it's coming to an end.
All right. Next question submitted also is, what is the difference between hysteroscopy, and I'm saying that right?
Hysteroscopy.
Okay. And a myomectomy.
So anytime you hear scopy or scope, SCOPE, anything with scope means just putting a camera and looking at whatever it is you're trying to look at. For instance, hysteroscopy, hyster means uterus. Scope is the scope going into your uterus to look in the inside of your uterus. Cystoscopy is bladder. Oscopy, putting a camera into your bladder, looking at the inside of your bladder. Endoscopy, it's your guts or your GI tract. So putting a tube down your throat and looking into your stomach, esophagus, small bowel is an endoscopy. Colonoscopy is putting a camera into your colon, looking with a scope to look and see in that. So anytime you hear scopy or scope, it is whatever it is in the beginning and putting a camera and looking in there, right? Laparoscopy is going into your belly with a camera, right? As far as myomectomies, you can perform anytime you do a scope, like a hysteroscopy, you could put a scope into the uterus and you can actually remove fibroids or whatever it is that's inside of the cavity that you're looking into. You can resect or remove it. So you could do a hysteroscopic myomectomy, which is removing the fibroids that are in the cavity of the uterus. You can remove polyps in the colon by doing a colon removal from colonoscopy, right? So that's a part of the procedure. As you look into something with a scope, you can remove things that you see. With a myomectomy, with a hysteroscopic myomectomy, you can only remove the fibroids that are in the cavity of the uterus. So like if you look in the uterus, this part is the cavity of the uterus. If you put a scope or camera into the uterus, you can remove this portion of the fibroid that's in this. But as you put this scope in here, you cannot
remove any of this stuff. All of this stuff is in the belly. So you can only remove the stuff that's in here. But if you have something like this, where part of the fibroid is inside and the other part is in the muscle, this part is in the belly. So you have to actually go in to the belly to get anything that's out here. So hysteroscopic myomectomy, again, just removing this stuff, but that's only the cavity that you're looking at. You have to go into a different cavity. So laparoscopy or laparotomy. Laparotomy means opening the belly. Laparoscopy means scopes in the belly. That means you have to do that to get the part that's actually in the belly for myomectomies. And anytime you hear ectomy, any ectomy means removal. Myomectomy, cholecystectomy, which is gallbladder removal, appendectomy, which is the removal of your appendix. Colectomy is partially removing some of your colon. Tonsillectomy, removing your tonsils. So anytime you hear ectomy, it's just removing whatever it is, the prefix of the word is, and ectomy is just removal. So that's just trying to teach you guys like this term. So when you go to your doctor and you hear some of this things like, damn, I heard what scope means. All right, I kind of get it. Ectomy means removal. Like you trying to take something out. Like you just have to kind of understand the words, and then you can kind of piece stuff together.
All right. Someone said in the chat, hello, I had a myomectomy and my doctor informed me not to have intercourse until 6 weeks. Y'all is on the sex tonight. So yes,
yeah, about that.
I don't know if that's directed towards me, but yes, listen to what your doctor says about the weight, because 6 weeks was the minimum, but when I got examined, I had to wait 8 weeks. So you may have an exam and they may say you need longer. So definitely listen to your doctor and not worry about who you're dating for how long you should wait. Period.
Absolutely. So,
and we were just
some
talking
question
about Real Housewives because a lot of people were asking about that episode specifically. So that's why I was just bringing it up for that.
And realize that some questions are very general, other questions are extremely specific, right? So when I'm talking about generalities of things, what have you. So when you have your doctor who performed your surgery, which he or she was the only person in there that knows exactly what they did, and not even you know because you were asleep or out of it, you need to listen to that person tell you whatever their practice is or whatever they're doing. Sex ain't that serious. Like if it causes you to have problems or issues, it's really not that serious. So listen, like as she said, 100% agree with, listen to your doctor. Like when you guys email me, I had surgery and my doctor told me it, I'm gonna tell you very generally, definitely, listen to your doctor. Like don't ask me about if you had surgery and what it is. I can give you my opinion and what I do for my patients, but the way I do surgeries are different from the way the next person does surgeries. And you have to listen to the surgeon or your doctor that's telling you those things. Like, don't just say, well, Dr. Johnson said I can have sex in 2 weeks. You go and you do something really messed up. Don't put that on me. Stuff I'm telling you is realize I'm extremely careful with my words. I don't put my foot in my mouth. Sometimes I do, but very, very rarely. I'm very careful with my words. So like, don't ask me specific questions expecting me to give you advice about what you specifically had. I'm just talking about generalities of things.
All right. Can you speak a little bit about a prolapsed uterus?
Yes, that was just a general question. Okay, so uterine prolapse or prolapse of any sorts means when you have a pelvic floor, right? So a pelvic floor is filled with ligaments and muscles that keep everything suspended. It keeps your bladder suspended. It keeps your uterus suspended. It keeps your rectum suspended so that it stays in this normal state. That pelvic floor can get weak. There are multitudes of different things that can make it weak. It's not just one thing. It's multiple vaginal deliveries, it's genetics, it's chronic lifting, like people that are like postal workers or weightlifters that lift over extensive periods of time. Smokers with chronic cough are another one. Genetics, consistent strength training people that have constipation over chronic periods of time, age, like it's multifactorial. All of those things mixed in can lead to a condition called pelvic organ prolapse, where the floor of the pelvis can actually start to get weak. And instead of suspending the things that are supposed to suspend up, it starts to develop, be envelope in and get weak. And the things that were suspended up start to prolapse. So your uterus that sits there and is normally very supported and structurally intact can now, if the pelvic floor starts to get weak from a combination of the things that I just mentioned, can start to push down into the vagina and down, 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 depending on how bad the prolapse is or how weak that floor is. The uterus can now prolapse or push into the vagina, into the point at very different stages. So prolapse is in stages, right? 0, 1, 2, 3, 4, and 4 and beyond, meaning called complete procedentia, where the uterus can now actually prolapse out into the real world, through your vagina, into where you can actually see it into the open atmosphere. And that's a surgical issue that people can, it's not always surgical, it can be treated other ways, but if you're younger, it's surgery. But that's what prolapse is.
All right. Next question in the chat. Are there other symptoms of fibroids besides heavy bleeding?
Yep. Heavy bleeding, pelvic pressure, pelvic pain, pain with sex, which is called dyspareunia, increased frequency of urination, abdominal pain, abdominal distension. Some if it can get big enough, it could be back pain. It could be urinary pain. It can back up your urine if it's pushing up on your ureter, cause something called hydronephrosis, or urine or fluid going back into your kidney. It can cause a multitude of different things. So any of those symptoms are like fair game. It can cause constipation if they're too big and they're pushing on your bowel, pushing on your rectum. Yeah, it can cause, one or all of those things, just depending. But just because you have it doesn't mean those things happen. Your fibroids really have to be of significant size to call bulk symptoms. Bulk symptoms are when your fibroids are so big that they're pushing on things, pushing on your bladder, pushing on your ureters, pushing on your bowel, pushing into your vagina. They really have to be big in order to be doing that. So if you go and you see a 2 or 3 centimeter fibroids or multiple 2, 3 centimeter fibroids, they're not causing you the bulk symptoms that you think of. We're talking like 10 centimeters or greater when they start to cause like bulk symptoms like that.
All right, next question. Hi, I had 3 babies and all of them were born with hernias. 2 of them needed surgery to remove them. I was told by the doctor it's more common in African American babies. Is there a medical cause for babies born with hernias?
Well, it depends on what the hernia is. So there are hernias that are genetic in nature, that are caused by genetic issues. There are also, so let me take it back. So yeah, there are genetic hernias in which there's a genetic link, if you will, like a weakening of the fascia in certain places. But there are also like embryologic hernias where there is a defect in the formation of the normal body of a growing embryo that can cause things to herniate, like your bowel to herniate. Those are much more significant. Genetic hernias in which patients have genetic predispositions to weakening of the fascia or the structural things that keep things intact. It is slightly increased in African Americans, but it's more so a genetic deal. Like if you have multiple kids that have hernias, it's more so an effect of the genetic effect of like your structural things. Like she would be probably more prone to having a prolapse, or probably have prolapse in her family, or like, some pelvic floor instability in her family. So it's just a fascia weakness or like a collagen or skin weakness in which that there is a genetic link to that in her family. Yeah, it's increased with Black kids, but that's not the reason. It's not because their kids are African American. It's more so that there's a genetic link that's causing a fascial weakness or skin or collagen weakness, that's probably causing those things. But it doesn't mean that you don't have a decreased life expectancy or can't have a full quality of life. It's just, just specific to her family.
All right. Next question. Can fibroids grow back quickly, like within 2 months?
No, typically not. If you got them off, unless you left them, right? If you have fibroids that you left, then yeah, they didn't just grow back. They just never left. But like I said, if you get all fibroids out, yeah, it's extremely unlikely that they would just grow that quickly like that. So if you had a myomectomy and then you had like, 2 months, 3 months, and then there's a significant fibroid growth, then chances are it just wasn't removed.
All right. Do fibroids shrink or grow during perimenopause or regular menopause?
Not significantly. You will have a slight regression of fibroids when you hit menopause and fibroids and your ovaries start to produce hormones, but don't expect to have like a 10, 12 centimeter fibroid and it's going to be a 2 centimeter fibroid once you hit menopause. If it's getting bad, if it's bad for you, don't expect menopause to really save you from it. Unless it's just bleeding. If bleeding is your only issue, then yeah, menopause will save that. But if it's a size issue, don't expect it just to automatically shrink to a level where it's not a problem when menopause hits.
All right. Can you reduce stress, eat foods that do not promote estrogen, and exercise completely to shrink your fibroids or eliminate them?
No. You can reduce stress, eat healthy, do all of those things for your overall general health, right? But like I said, you cannot expect you to have advanced fibroid disease or multitudes of fibroids and expect just those lifestyle modifications to fix the problem. It's not that. That's more so what I was talking about earlier. It's like diet and healthy lifestyle things are going to do a lot of things for your overall general health, but there are conditions that we have that are not predicated completely off of diet and exercise. So intuitively, we think that diet and exercise is going to fix everything, no matter what it is. If you just eat right and you exercise, you're going to be 1,000% healthy. You're never going to have any disease. You're never going to have any problems. You don't have to take any medications, but that's not true. There are things that happen to our bodies that happen in which we have to have medicine, right? It's people that have never had perms, have never eaten meat, and never done anything and have a cancer or have, high, hypertension or what have you. That these things happen, and people don't want to admit that, but it happens. And for that's what medicine is for. If it's something in which we could just diet and exercise modify, every doctor with a brain is going to tell you that, right? There's no, at least not me or any doctors that I know that's not going to tell you to eat right and exercise right. That's our job. We should be telling you to do that first. But with that being said, we should also be realistic about what that's going to do and other things that are not going to fix whatever problems that we have. And as much as people want to argue about it, whatever, everything, I say this over and over and over and over again. Whatever treatment that you talk about or whatever it is that you're saying should be reproducible, right? It should be reproducible in a randomized control trial, meaning that If I had 1,000 women with fibroids and I have 1,000 women without fibroids, I take them, all of them, and then I do a randomized control trial, which is this. I take whatever it is I'm looking to study, sea moss, elderberry, ginkgo biloba, whatever you want to say, drinking hot tea, whatever you want to say, right? I should be able to take those 1,000 women and give them whatever it is I'm trying to study, and they don't know it. And then the other women, they're just taking placebos, or women with fibroids, more women with fibroids. I said that wrong. Both women have fibroids. Whatever it is you're trying to test, they get it and don't know. The other women with fibroids just get placebo, sugar pill, water pill, whatever you want to give them. And then you follow them out. You look at everything. You look at fat women, skinny women, African-American women, Asian women, women over 50, women under 45, women that had 8 babies, women that smoked before, women that, like, you look at all of those variables, and then whatever it is that you are testing should have a statistically significant finding that they're making the change that you're claiming. Meaning, this X amount of women took elderberry, they had a 3-centimeter shrinkage of their fibroid growth with serial ultrasounds, or they had their symptoms were significantly reduced because they took sea moss. And the problem is that people are making these claims and they don't have the studies to show that sea moss is reduced. And I'm just saying this, I'm not picking on people that drink sea moss smoothies and got sea moss IVs. I'm just using this as an example, so don't get offended. But whatever it is, I know they're gonna come for me. Whatever.
Sea moss have.
I'll be ready for them anyway. But whatever it is that you're saying should have that effect to where it's reproducible. And too often it does not. And people are believing this stuff, and it's not doing what they're claiming. Because, for instance, if you have to realize we're in a capitalistic society, right? And we in Chicago on top of that. So if I have, what's up, Leon? If I have anything that I'm trying to test, or anything that people are naive on, I can sell it, right? I don't have to have facts. I don't have to have anything. I could get on, I could read. It'd be killing me. It's this one dude, I ain't even gonna call him out, but it's this dude, I swear you could tell he read about 3 textbooks, and he just, man, he own it. He is on it. Like, he read the textbooks and he be using all of the keywords and all the terms, and everybody be, yeah, he know it. Them doctors don't know shit. They don't know a goddamn thing. This, he know it. He's like, and the fresh fruits and the vegetables and the herbs, and this is gonna do it. I had these women and they took it and they fibroids, blah 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 blah. Like, he don't know what he talking about. What he does care about is that $49.99 that you about to send him every month for whatever it is he's trying to sell. He cares about that, because if he didn't care about it, right, he'd do it free. Or he would say, like, hey, like, hey, here go a couple trials, see if it work out for you, and then let's talk about it. They're not gonna do that. It's capitalism, and you're listening to people that have absolutely no idea what they're talking about, right? If I was to get on here and I was like, hey, I'm the lash king, right? I got all these lashes, I got weaves, I got it all. Like this little magical elixir is gonna make your hair grow because because Dr. Johnson put his name on it, blah 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 blah. You're not gonna believe me. Or some of y'all might. I might be able to. I told y'all once in a minute I'm about to pull the whammy on y'all. I'm telling y'all, once I get on this TV, listen, once I get on TV, I'm gonna start acting brand new to the point where it's like, hey, wait, hey, can I? Nah, I'm gonna start doing like some of these other folks where y'all paying them excessive amounts of money to fool y'all and trick y'all. Like, stop it. Like, no, you would not listen to me tell you about something that I don't know about. Stop listening to people tell you about medicine, your health, your body, or what have you, and they don't know about it. You eat healthy for your general life, to be more healthy. You exercise for your heart health, for you to be more healthy. It's proven that you're going to be more healthy if you eat right. Whatever you put in your body, exercising, all of that stuff is going to be more healthy for you and do the right thing for your body. But it doesn't mean you're not going to have normal ailments. Like, it doesn't mean it's going to fix everything. Some things just are not going to be fixed, and be very, very cautious about what you spend your money on and who you listen to as it pertains to your health and what you're trying to accomplish. All right, I'm done. I can talk about this shit all day, I swear to God, because people be trying to come in my inbox and be trying to argue with me or what have you, and it's so aggravating.
No, I think
I
it's
promise.
important though. I think it's important that it's said though, because as a patient, I literally lost 85 pounds prior to having fibroid surgery. I thought I was causing all my heavy bleeding. I thought I was the reason. I mean, I just didn't want to have surgery anyway, so I would have made up a lot of things was the reason.
Mm-hmm.
I feel wonderful losing 85 pounds, but having surgery and now still being, well, I'm actually a little bit more down, but having surgery and getting to actually have all the benefits of my weight loss is a much better life than, oh, I lost 85 pounds, but I still was walking around with this kid, a midget, or whatever he with the laptop attached to the hip, whatever he likes to tease me and say. I couldn't even enjoy it like I wanted to, because as soon as that monthly cycle rolled around, I was back a prisoner in my body, no matter how much weight I had lost. It still feels amazing to lose weight, eat right for general health.
Correct.
Trust me, I go up and down. I was struggling to go up and down stairs in the house, and I do not have a mansion at all. So I don't do that anymore. I did lower my A1C naturally. I wasn't taking medication for diabetes or anything, but still, now I'm not even close to needing it or whatever the case may be. So you still will feel better, and don't take it as, oh, well, then I don't have to worry about it. No, you should still want to feel better, because I definitely feel better. But the surgery, what my mama say,
She's living her life like.
You ain't know I was gonna ask you. She like, wait, what?
Put mama on the spot.
Mama done start eating crackers and getting on her phone. She's like, wait, what? Sorry, Ma.
You put mama all on the spot. She was like, man, what happened?
Right. She like, what I missed?
Crazy.
Sorry, Ma. But no, I was just telling them I feel better.
Right.
Yeah.
She
So,
feels better, and she looks better, and she's living life like it's golden. Period.
absolutely. Well, it's amazing what 7 pounds of just a mass will just do for you, losing it.
Yeah. And then I still lost even more weight after the fact.
That.
So
yeah,
I lost the fibroid weight plus regular weight. Like I told you, I finally got back down to under what I was before COVID, because I did gain weight during COVID. So I be adding that on to what I already lost. So yeah. So it's very important. I'm just saying, like, definitely you still want to eat right.
Absolutely.
But if you need surgery, you just need surgery. It's like,
that
really
is what it is.
It is what it is. And like he said, at my first visit, I was like, are you sure? It's nothing else I can do. And everybody else.
I mean, you can.
You
got an option. You can walk around with that for the rest of your life. You know what I mean? That's always
the options I was looking
right.
for.
That's what right.
But you
yes, if I can give a magic pill or something,
non-invasive option, which was very different than what I heard before, and that wasn't something that I heard before, so that's why I was able to trust you.
Yeah.
All right. So since you said when I'm on TV, a lot of people is DMing me like, "Where's the show? How do I log in? Cola, what's the link? Cola."
All right.
They definitely think I'm your personal assistant. So could you talk a little bit about that, please?
All right. So this is what
think I'm holding out on them, and I'm not.
So I'm not. So all right. So episode is done with. So this is what happened. So full transparency, right? So when I kind of did it before I came over with the idea of Fibroid Slayer, whatever, I had somebody to kind of like scout it out, and the networks kind of scoffed at it. They was just like, whatever. It's like, we got pimple poppers and stuff, whatever. So I was like, cool. So what I said was, all right, I'm gonna do this for real. I'm gonna pay a staff. I'm gonna pay a whole production team, and I'm gonna do this thing the right way. I'm gonna get a reel. I'm gonna get an episode or what have you. And I did that. I gave y'all the reel that I paid for, and the reel is dope. Then I put a whole episode together where like I had twins, like they had their surgeries or whatever. Episode is super dope. I got it. And so when I was like about to put it out, which was the May 21st day or whatever day I put on there, when I was gonna put it out, It was an agent was like, hold on, my friend, time out. Don't do it. Like, this is dope. This is like super dope. Like, there are like networks that want this thing. So don't put that out, because if you put it out, it's like it's going to like lose its gusto or whatever. So I have the episode. Now it's just like agents that are saying like, listen, let's have a conversation. They talking to different networks or what have you as we speak, to for it to be released. So that's where I'm at right now. It's not that I kind of pulled the whammy on it. It's coming. No, whether even if they say no, I say yes, right? So I have it, and I'll just start releasing them myself. But whether it's gonna be on major networks and like for the Bravos, TLCs for you all to see, like Pimple Popper, or is it gonna be just me doing it solo, and doing it like on YouTube, whatever? That's just the question. So that will be very, very soon. So just stay tuned. But yeah, it's not like Fibroid Slayer is coming for sure.
And I'm not holding out on y'all. I promise y'all. I'm the plug. I definitely will
Yeah.
post it.
I gotta show you. I gotta show you the whole episode too, cause I ain't do it. I'm gonna show you the episode. It's like super dope. I'm excited about it, so it's super, super dope.
Definitely. No doubt. No doubt. All right. So is this a good place to stop for next time?
Yeah, I mean, you can ask one or two
Okay.
more questions.
I just wanted to make sure
we could
before I screenshot.
Yeah.
All right. So since you have your information in the chat, but
Yeah,
when
so
someone is asking,
initial consultation you can get right away. So here's the thing about consultations. All right, so let me say this, okay? Listen. So I offer virtual consultations for everybody that cannot see me in person. Like, so everybody's calling me California, Atlanta, Miami, New York, or whatever. If you're calling me from these places, like, the virtual consultations are what I am offering to everybody that's listening, so I can listen to everything. I'm listening to your history. I'm breaking down all your options, talking to you about everything, all of that stuff or whatever. I'm doing that on my own. Like, I'm not going through any insurances or what have you do that or whatever. Insurance, what you all don't know is insurances pay me pennies on the dollar, like, to do that, to do anything, like surgeries. Like, from surgical standpoint, we're the lowest per people on the totem pole. Like, if you look at like the surgeries, like whether it's to get a knee replacement, plastic surgery, whatever, like all of those surgeries get paid excessive amounts. When it comes to women's surgeries, it is the lowest thing on there. So literally, I am doing these things because I want to, and I love to do it to help people. At a certain point, the price is gonna go up. But with that being said, I'm telling y'all that full transparency. So if you need surgeries, I will do it now. Like, don't wait for another year. Like, oh, wait, don't do
yes,
it.
today's price.
It's not today's, because I am doing like 4, 5, 6 hour surgeries, removing everybody's fibroids through small incisions or what have you. And I'm doing it because I love to do it or what have you, but it is not lucrative. I do way more other things that give me way more money than doing that. I literally do that stuff because I love to do it and I love to help people. But trust and believe there will come to a point where there will be a fee for me to do this for people. Right now, it's not there. It will be. But with that being said, for consultations, the virtual consultations are out of pocket. It's not, I didn't put a price that's extensive for people, but it's going to be something that's for my time, right? So that's where the virtual consultation. So please do not inbox me, well, how does my insurance pay for a virtual consultation? It doesn't. It's my time giving you on a Thursday where I am taking a whole hour to talk to you and answer every single question that you have calling me from California, right? So you could do that. Everybody asking about that, you can get that right away. It is for you. For calling my office, if you call my office for a virtual consultation, they're going to send you to the website. If you call my office for in-person consultations, absolutely, that's where your insurance can come in. You can come talk to me in person for an hour and utilize your insurance, because I'm there Monday and Fridays from a particular time. If you're in there, absolutely, you can use your insurance, whatever. That's what I'm there for. But if you need virtual consultations, that's just what it is. Don't look for your insurance to pay for it. It's just not going to do it. But that's just how it is. I'm giving that service for people to be able to give the time for me to talk about everything and put your options out. Even if you can't come to me for surgery, at least know your options and know what makes sense for you. I'm going to talk to you like you, my aunt, my mama, my sister, right? And I'm going to tell you what is the honest thing that makes the most sense for you. Whether you like it or not, I'm going to tell you those things. So that's the consultation thing. You can get consultations right away virtually, in person, usually within about 2 weeks or so. So if you want to, if you like, I just want my insurance paid for, you can fly from Florida to Chicago and see me in person and see when those Mondays or Fridays. I don't have a problem with that. But that's just how that goes. All of that to say that.
All right. What is considered advanced fibroid disease?
So that is a term. Well, I utilize, for me, advanced fibroid disease is fibroids that are greater than 10 centimeters, and for a uterus, for myself, is greater than 24 weeks gestational size, meaning above your belly button, right? If your fibroids in your uterus are above your belly button, Cola, you're on a whole different level. But advanced fibroid disease is above your belly button. That's just for me. Some doctors will say that is like, oh my God. For me, it's just advanced. Like, I look at it as less than belly button is you have fibroid disease, but it's not, it's there. But advanced is bigger than your belly button. You have fibroids that are bigger than 10 centimeters or numerous to the point where it's making your uterus grow above your belly button. That's my definition. It's not a textbook definition. It's just my personal definition of what it is. Other doctors will tell you differently.
All right. How is it possible for someone outside of the U.S. to have surgery out of pocket? What is the average out of pocket cost?
So it's different. It really kind of depends on what you want and what you need. So again, I'm the low person on the totem pole. Like, as far as the actual surgery in of itself, I'm not getting excessive amounts for the surgery, but who are getting it, the hospital for using the operating room, the hospital stay, which is expensive, the anesthesia to it is expensive. Usually, not usually, if you do not have insurance, which somebody from out of the country would be considered an uninsured patient, the hospital has to give you a 40% reduction of the normal cost. So typically, out of pocket, if you have like a myomectomy and a 2-day stay, it would be anywhere in the range of probably $15,000 to $25,000. That's being conservative. If it's something more simple, like an outpatient, like Acessa or something, clearly it's going to be much less than that. But for your particular case and what you're trying to do, definitely reach out to me, and I can try to put you in contact with a hospital and find out. First, I got to figure out what you need, right? So we had a consult to figure out what you need. Once I figure out exactly what you need and what surgery you need, now we can take that to the hospital, and they can give you an out-of-pocket cost of what it'll cost you as a patient, what it'll be for like a 1-day stay, 2-day stay. They usually give a global cost for what it will be. It varies just depending on what type of surgery you need, though.
All right. I had a hysterectomy, leaving my cervix and my ovaries. What is your opinion on leaving the cervix?
Take it. It's no point in keeping the cervix. If you got it, then so be it. That's great. But for me, I'm not telling my mama if she got a hysterectomy to leave her cervix, right? Because now you still have to have pap smears. There's still the risk of cervical cancer. And for what? It's not making sex any better. Cola can tell you, like, her sex is more enjoyable now than when she had her fibroids and stuff in there. Like, it's not doing anything for you. It doesn't increase your risk of prolapse. None of those things. It's just there. So it makes sense to remove the cervix if you're having a hysterectomy. If my patient wants to keep it, I would try to talk them out of it. Honestly, it just does. It's everything should have a reason. Keeping your cervix for a hysterectomy, unless you had, like, you were getting a hysterectomy because you had a pelvic floor problem or a pelvic prolapse and you needed the cervix to suspend. So I do this surgery called a sacrocolpopexy for patients that have prolapse, in which I remove their uterus, but because they have their weakness of the pelvic floor, then I attach things to the cervix to pull it up. I attach a mesh to the cervix, pull it up, and attach it at the back of your back, the bone on your back. And that's called a sacrocolpopexy. So for that, cervix is great. I need the cervix to do that. You don't need it. You don't have to have it, but it makes it more easy to do that. But other than that, if you're getting a hysterectomy, take cervix out, please.
All right. What is the difference between an ovarian cyst and a fibroid?
Two totally different things. A fibroid is a growth of abnormal smooth tissue that is only on your uterus. Fibroids don't occur in your ovaries, right? Ovaries are different. They can have they're separated between pathologic and physiologic cysts. Physiologic cysts are normal. Like every month in which you ovulate, you create a cyst. That cyst rupture and it releases an egg. If you scan any woman, I don't care who she is, of reproductive age, at a given time of the month, she will have a cyst on her ovary. So it aggravates the piss out of me when women go in for pelvic pain, they go into the ER, and the doctor just says, hey, you have ovarian cyst. Now she's taking this ovarian cyst diagnosis and ran with it. Ovarian cysts do have a physiologic component to where they're normal. The difference is there are pathologic cysts that are problematic, that come from endometriosis, that come from embryologic origins. Like, have you heard hair and teeth in a cyst? That's called a teratoma. And those are embryologic origins of cysts that can happen that are pathologic, that are in the uterus, that are in the ovaries, that can cause problems and need to be dealt with. Physiologic cysts do not need to be dealt with. They'll go away on their own. Pathologic cysts can be a problem and they do need to be addressed. Huge difference between the two, but cyst and fibroids are two totally different things, and two totally different structures, ovaries versus uterus.
Okay. Next question says, do you ever recommend hysterectomies to your patients?
Yes, you said one.
So
Prime example,
I'm
one
a
right there.
patient. Dr. Johnson is going to give you all of your
The
options. He is going to tell you every possible treatment for your condition. He will give you his recommendation, but ultimately it will be your choice. So another person asked me, why did I choose hysterectomy? I chose hysterectomy because I no longer was interested at all in having children, number one. So I know the purpose of the uterus was to have kids. Number two, I was very scared to have surgery, and he was the first person that said, well, how about we do it robotically? And I said, wait, what's that? And he said, you don't have to be cut. You don't have to get a vertical incision. I put these little holes in your tummy and the robot do the work. And I said, well, okay, let's try it. Even though I still said a whole bunch of other stuff that was trying to stall too, but I did finally agree. So I was able to get non-invasive, quick recovery time.
Minimally invasive, because they say no, it's a minimally invasive.
Okay, minimally invasive, very quick recovery time, because he said that generally people are back to feeling their self 2 weeks. I was able to not have a long hospital stay. I've only ever stayed in the hospital to have children. I never spent the night in the hospital. That was another thing I was scared of. And he said, nope, you'll be gone by the next day if no complications, whatever. So there were a lot of things that were attractive to me by having a hysterectomy. And like I said, rumor mills, your vagina gonna fall out. You're not gonna be able to have sex. You're gonna dry up like the desert. All that's false. Did not happen. I've talked to plenty of other women. I'm not the only one, but women reach out to me constantly. Hello to you all that are on tonight. We all have the same story. I'm just probably a little bit more vocal about it, because it is hard for people to show you their vulnerable side. So it's not that they don't want to share, Dr. Johnson. It's just that it's hard sometimes to be vulnerable.
I ain't worried about it. That's why you're here. That's why it's important for you to be doing what you're doing. Like, they don't want to hear from me or what have you. And I urge them to go and to talk to my patients, especially since you're so willing and open to talk to people. Like, talk to them. But I say the same thing. Like, I talk to every person, every patient, whether it's virtually or in person, like you are my family. I'm not going to tell you anything that I wouldn't tell my own mama, right? I'm telling you the things that I understand, that I'm woke. right? I know what Black women have went through. The reason I'm doing this is because Black women have been brutalized for centuries. They've like the gynecology happened off of the backs of slaves, right? The reason we're doing this surgery, the reason I'm sitting here right now is because of slave women. White men held down slave women and did experimental surgeries on them. These are facts. The reason why hysterectomy is what it is now is because it was used to weaponize Black women. They were used and brutalized Black women. I am completely cognizant of this. So when I talk to you, I understand that. I understand your apprehensions about hysterectomies. I understand that your mother, sisters, cousins, like they went through bad surgeries. So when I say things, I'm totally cognizant about all of that. Even with that being said, I'm telling you what I'm telling you. The reason you have a uterus is to have babies. That is the only physiological reason you have a uterus. It does not put you in menopause if you leave it. Your ovaries do that. If you remove your uterus, you keep your ovaries. You do not go into menopause. You do not have any changes other than not having a period. So if you have a fibroid issue or major bleeding issues or complications of life because of your uterus, and you no longer intend to have a child, hysterectomy has to be an option for you. A hysterectomy with minimally invasive small incisions can be done to remove all of your problems as it pertains to your uterus. If you have need for your uterus, meaning you want to have a child, then nobody should tell you that you need to have a hysterectomy. By all means, you should be able to keep your uterus. That's why I do the things that I do. But with that being said, I got a 51-year-old woman right now with extensive fibroids, extensive, horrible, that wants nothing but a myomectomy. She don't want children. She don't want anything. She wants me to cut into her belly, take out these fibroids, and return her uterus, where I could do exactly what I was doing for you, do a robotic hysterectomy, take it out. She out of the hospital in a day. She don't want that. I didn't talk to her she blew in the face. She wants to preserve her uterus. I had to change my thinking and what I'm willing to do to actually help her, because 4 or 5 years ago, I would just tell her to go see somebody else because it just doesn't make sense to me. It still doesn't make sense to me. I don't agree with it. I don't recommend it. But for her, it's her decision, her option. If she wants to take the risk of that big surgery to do it, I'm not going to be the one to tell her no. I'll do it. But hysterectomies are not bad. You really, really, really need to think about the decisions that you make about your body and how it impacts you before you make them, and have somebody that's going to be able to extensively talk to you about what things mean. Because y'all hear, I swear to goodness, y'all comments in my office and call me about every Facebook group, everything you done heard, what she said, mama them said, cousin them said, whatever, and they cannot explain these things to you. You need to have somebody effectively explain everything to you and then make a very informed decision about what you're doing. And if you do that at the end of the day, then God bless, perfect. But please make informed decisions in which you know all of the facts about what you're trying to do.
Yeah. So one thing that people inbox me a lot about is I'll never get a hysterectomy because God gave it to me. I was born with it. I'm going to die with it or whatever. So I will always tell them a personal story. My brother got a kidney transplant from my dad. His very first kidney transplant was from my dad. So if my dad felt that same way, my brother would have compromised some years that he got back on his life to not be on dialysis, to have a dialysis-free life. If the science has already proven you can live without that organ, trust and believe, it's way, way 2 years beneficial to live without it if it's causing you that much harm.
I mean, that whole line of thinking is just crazy to me. If you had appendicitis, you're gonna tell them I'm dying with my appendix.
Exactly.
You're not touching it. You're gonna get it taken out. If you had gallbladders, gallstones, right, and an inflamed gallbladder, you're gonna say, nah, I'm gonna die with these gallstones. No, you're gonna have them take out your gallstone because it hurts, and you're gonna take it out. So why is that thought process different? I understand why. I won't say why.
Yeah, I was gonna say, I
But
think
you
the
just
thought
you have to have the
process is
same open.
different
Yeah.
because the
Yeah.
mental block of it's taking
Correct.
away my fertility. That used to be the black, like
Correct.
you said, all the things that you're cognizant of that they tortured us with our uterus is you know, you may not have lived it, but it's still passed down, or in a previous life you experienced something. I don't know how to explain that, but I always try to shift the thinking, well, here's an example that I can personally relate to where a living person donated an organ because they didn't need it. And look at, you know, it was a wonderful thing. You know what I mean? Like, so I just try to say, like, look at it from a different angle, because I understand the angle you're thinking of, but there's
Right.
other angles. Or if say for instance, you were a surrogate for somebody and then you say, well, that baby grew inside of me, so I ain't giving it to you. How would that feel?
Right.
You know?
Correct.
So it's just one of those things is sometimes it definitely is more harm than you're doing to just think like I'm gonna just die with it because it was given to me. Well, yours is messed up right now. So
Facts.
yeah.
Big facts. All right, we almost close to 2 hours, so we might as well just go all the way up until the end and be done. So,
Okay.
Yeah.
All right. Since you're talking about cysts, my niece was diagnosed with an endometrial ovarian cyst. Is surgery the best option?
Well, it depends how big it is, if it's causing the problems, how bad her endometriosis is. That's a complex question. That's one I would have to see specifically. Just because you have an endometrioma doesn't necessarily mean you have to have surgery on it. But if she has an endometrioma of significant size with very symptomatic endometriosis, then yes, surgical intervention is an option that she should consider. But that's a very specific one. I wouldn't say everybody with an endometrioma needs surgery. It's case by case specific.
Okay. What do you recommend as the best way to treat fibroids? They literally type UFEs and myomectomy, ET. Uh-oh. You about to get them up? Or we about to?
I ain't even gonna go back to the last live. Go back to like I did a whole video about UFEs. I'm not talking about UFEs. Please go back to that video. I will tell any interventional radiologist, any gynecologist to their face, I don't agree with UFEs, UAEs, uterine fibroid embolization, uterine artery embolization. They are synonymous, the same thing. I don't agree with them. They're not a great treatment of fibroids unless you're debilitated or have other issues that in which you can't get, other fibroid treatment options. I give it to my patients as an option because I don't believe in robbing them of options, but I have my opinions about them. Would I give it to my sister or my mama or my aunt? Absolutely not. There's no way in shape and on hell's earth am I giving or suggesting that they get a UFE or UAE. So, but as far as what's the best treatment, everybody is different. It depends about what your goals are and what your fibroids are doing to your body and where they're located, how big they are. Everybody's different. That's what consultations are for. To really specifically look at what people are like, oh, you're just trying to make money. You're just trying to talk. No, I got to sit there and ask you family history, what your symptoms are, how long your periods are, how many pads are you using, are you having pain with sex, are you having frequency of urination, like what are your goals, are you trying to have children, are you trying to just fix your symptoms? All of these questions we have to talk about extensively, in addition to looking at your MRIs, your ultrasounds, all of those things to get a comprehensive picture and then tell you specifically what your options are, what makes sense, what my recommendation is. That's what consultations are for. There's no way I could say, hey, this is the best thing to treat fibroids. That I can't do it.
So people actually question that you charge for consultations when it's work. Like when they go to work for free?
But see, when medicine is different. Like medicine's different.
It's the server.
You're supposed
provider.
Yeah, you're supposed to. Like everybody's like, is like, no matter what, you go to your hairdresser, lawyer, any of those things, like you tip people, you do all type of stuff, like that's the way society and everybody works, except for medicine. We're supposed to answer questions, we're supposed to do stuff, whatever, just because we're dealing with people's health. It's not clients anymore. Everybody else got clients. Lawyers got clients. Beautician got clients. Accountants have clients. You name it. Everybody has clients. We have patients. So it's a difference,
I
right?
think it's
And
still
so
a service level thing.
I
'Cause I
agree.
have
I
clients,
agree. I
and
agree.
boy, when they
I
think
agree.
you working for them,
Listen, ain't nobody ever said, hey, you know what? That was, man, this surgery, like, you really saved me or whatever. Here go a tip. Ain't never gonna happen. It's never gonna happen. But it's just the way we think about it. I should be, because that's why I feel a certain way. Like when I be going out tipping people, I'm like, I tip people real good. Well, I ain't nobody ever tipped me, like, ever in life. Like, they get mad if I like ask for anything or do anything. So it's crazy
you will be
how it is,
surprised
but
how
it's just
many
like,
clients don't tip as
and
well. So I'm
that's
telling you,
nuts.
it's a
That's
service
crazy.
provider thing.
You're medicine. You're in medicine now.
All right, I do both.
Right.
I juggle both, right? Because I'm your medical. I get people
Right.
that ask me when they should schedule their follow-up visits too, and I'll be like, I'm not his medical assistant for real. I'm just the live medical assistant.
Right. And then it's like people don't even realize, like people are asleep. I mean, I'm dead to the world and under anesthesia when I'm doing these surgeries. So it's like they don't see that I could have took the big one. I'm an hour and a half, 2 hours in. I got the big one, and now I got another 3 hours getting pebble-sized fibroids just digging. Like I'll dig, and then I'll step away, let my resident kind of dig, so I could clear my mind, and then come back and just start trying to dig and find more fibroids, like an Easter egg hunt. I don't have to do that. I swear to God, I'm not getting paid anything to do that. I do it because I know for me, in my mind, it's the right thing to do. But people take that stuff for granted. Like they don't give a damn, whatever. It's whatever. I don't do it for that. But when I look at how things are set up, it's like, man, at a certain point, I'm going to be like, you know what? What am I doing? I'm not there yet. I swear to God, I'm not there yet. I'm getting there, though. Just so y'all know, I'm getting there.
Well, I'm just telling you, get out the service industry because
Right.
I'm telling you, it's
I don't know. But it's like I wouldn't, but it's like people would go to, like, you talk about a consultation, but you'll fly to Miami and pay $15,000 for somebody to suck some fat out and put it in your butt and don't ask no questions whatsoever, or you'll do all of these things or what have you. And there go one of our patients right there too. You are so very welcome, Felicia. I was happy to do it. She living her best life. She about to throw bikinis on and everything else. But it's just like, when you start questioning that stuff or what have you, it's just like, man, it's like for my patients that are grateful and people are grateful for what I do or whatever, that's who I do it for, and that who give me the energy. But you would be surprised. I got people that are totally
I'm not
ungrateful
surprised.
about stuff, man. They are like so ungrateful, and it'd be like, yo, what am I doing? Like it made me question, like, why am I doing it?
It be the love part of it. You can't
Yeah, it do.
disconnect, because I told you didn't have that glow when you wasn't operating.
Yeah, I
You
did.
didn't have the glow.
I did. That's all right though. When I get it, man. When this show kick off, when I get on TV, I'm start doing y'all like Dr. Miami.
You're gonna be
Like,
brand
oh man, you got brand new. Yeah, I did. Kids got these.
brushing out the plastic. I've been
Right.
acting. You're gonna have to do the TikTok.
Yeah, right. I sure I am. I'm like, oh, you want me to be staying here 6 hours picking out pebble-sized fibroids? Hey, your insurance pays this. I need a little extra bag. Come out.
All right. Well, we at our 2-hour mark.
Yep.
As always, a pleasure. I'm always thankful for all that you do. Definitely, a lot of your patients reach out to me.
Oh,
And I'm very
asked
thankful.
they asked my daughter. They said, "Where's Little Bit?" She on here. She was on here. She left. I would have chimed in here. She playing softball doing something. So I'm at work.
Oh,
But yeah, I would have let her hop on in. She will next
yeah. So,
time.
Mom, any last words since you joined us for real today?
This was a real pleasure. I didn't have to wait until she downloads it to YouTube, which is how I usually get to see it. So this was very enjoyable, and I hope to be able to join in again sometime.
Absolutely, Mama
Since she
Carla.
lives next door
Oh
now.
yeah, so I recently purchased a home next door to my mom.
Look at
So
that.
I
Look at
take care of her.
look at Mama's big
I
baby.
know.
We know what it is. Ain't
But
just
the
taking Mama. Yeah.
good thing is I live on her blind side, so she
Mm.
can't be watching
See
everything.
what.
But no, I'm gonna always take care of you. Always.
Oh, look at it.
So yeah, no, I recently moved, so this was the first time. So I told her, well, walk next door. You got me right here doing the live, right next door, live and in person. So
All right. Until next time, we won't
yeah,
we
so
won't
no, we always
wait too long. We'll do
appreciate
it in a
you.
couple weeks.
And we definitely, yeah, I was gonna say, because I definitely keep the list going. So keep the questions coming. Thank you all for joining. We definitely are committed as long as the people need the information. I ain't gonna let them act brand new with me. And the drama of the show, if y'all knew how much I go through to plan these lives with him, oh, that's gonna be the highlight. Y'all want some drama? Y'all should see what I go through to plan.
Facts.
No,
Facts. She is
it
persistent.
ain't like that. But you know, coordinate. We both are busy people, so we do have to coordinate. But
so we hope y'all enjoy it. I think this is super dope. Like y'all just have to listen to a doctor just talk like you actually listen to from a patient and a doctor's perspective. So share this. I think it's like good information for everybody. You know, I think it's a dope platform. That's why we both continue to do it. So you know, share it. Don't hoard the information.
Don't hoard it. Yes, and I do always download it to YouTube as well, just because if you have older family members that are still look very young and they want to be able to participate, they can watch it without having social media.
Thank you, Dr. P, for all you do. God bless and keep you safe.
Absolutely. I appreciate it. Thank you guys.
All right.
Talk to y'all
Take
later.
care, everybody.
And I'm gonna post this on my page. So if y'all go to my page, it'll be there, and then she'll post it to YouTube. So I'm gonna post it to my page now. So if anybody missed something, didn't see something, just go take a look at it. Answered a lot of questions today.
All right.
All right.
Thanks again.
All right, I'll talk to you later.
All right. Take care. Bye-bye.